Hey everyone, today we're going to demonstrate how to properly operate the iStat system. The iStat incorporates comprehensive components needed to perform blood analysis at the point of care. This analyzes blood gases, electrolytes, chemistries, and hematocrit levels. When you first turn on the iStat, it will display a test menu and you only have two options available at this point. However, in order to use the iStat, a simulator is required for sample calibration every 24 hours before patient testing can be conducted. To begin calibration, press the menu button and it will display an administration menu. From here, press 3 for quality test and then press 4 for simulator. At this step, you would usually enter your ID number here, but we use A as a reference. Whenever you are entering an ID number or patient number, you have to enter it twice. Now grab the simulator and scan the lot number. As you can see, I'm having a bit of trouble scanning it. Now take the blue lid off and then you can insert the simulator. It will approximately take 2 minutes for calibration. During this calibration, you can make sure all the equipment is ready to use before patient testing. If the calibration is successful, it will show pass on the screen. And now you can perform patient testing. The cartridges are usually sealed in individual pouches and are refrigerated at a temperature between 2 to 8 degrees. Make sure to place the cartridges in room temperature for at least 5 minutes prior to testing. If the pouch has been punctured, the cartridge should not be used. Furthermore, you should also check the expiry date and make sure the appropriate type of cartridge is used. Now we will start our demonstration. The iStat requires a relatively low volume of sample, which is around 0.95 milliliters. For this demonstration, we are using a control sample. To start the test, turn on the iStat and press 2 for the iStat cartridge. Now you are required to enter your operator ID, so again we will use A and make sure to enter it twice. It will now ask you to scan or enter the patient ID. In this case we are using 1 as our patient ID number, but always double check if the patient details are correct. After this, always check if you have the correct cartridge type and is still within the expiry date. You can now scan your cartridge lot number and it will display Insert Cartridge. Before this, open the cartridge pack, and this may be the hardest part of the test. Normally, you use a syringe or catheter, but in this case, we'll be using a transfer pipette. Make sure to gently mix the sample before aspirating it. At this point, grab your pipette and open the lid of the tube. Now squeeze the bowl of the pipette to aspirate the sample. Ensure that you close the lid properly to avoid contamination. As you can see, there's a small well where the sample will be loaded. Now carefully pipette the sample into the well and make sure it has filled up the capillary area. Once you have done this, dispose your pipette in the general waste bin and make sure the flap is closed. Now insert the cartridge into the iStat, and it requires approximately 2 minutes before the testing is completed. Now you can review the results by pressing the right arrow button until it says results ready at the bottom of the screen. Here you can print your results by pressing the print button while pointing at the printer. Once you have printed the results, ensure that you fill in the patient's name and the operator ID. For the next part of the demonstration, we will show you how to troubleshoot a couple of common errors. In this case, the cartridge lot number has expired. Now if you attempt to scan the cartridge lot number, the screen will display lot expired. Although it is a simple correction, this emphasizes the importance of checking minor details before testing. The second issue we will demonstrate is the mishandling of the cartridge. Again, we are doing the procedure as usual. As you can see here, when the operator closes the flap, his finger accidentally presses against the center of the cartridge. After inserting the cartridge, the screen displays an error code 21, which indicates cartridge pre-burst. To avoid this error, make sure you're handling the cartridge in a suitable manner. Now for the next issue, we're going to demonstrate what happens if you put an insufficient volume of sample into the capillary area. When this occurs, it will show error code 38 or 39, indicating there is not enough sample in the sample well. This is a common error, so ensure using proper pipetting technique and always check if the capillary area has an adequate volume of sample. To summarize everything, we have demonstrated how to calibrate, operate, and troubleshoot the iStat. We hope this video was insightful and has taught you how to effectively use the iStat system. Thanks for watching.